Está grabando.
Va, ok, una, dos, tres. Welcome everyone to this special interview session. Today, we are here to get into a crucial topic that has marked our lives in recent times.
That's right. Jair, we're about to discuss COVID-19, a topic that has been at the center of all conversations, news, and concerns around the world.
Undoubtedly, this virus has transformed our lives in ways we never imagined. From how we work to how we relate to others, everything has been influenced by this pandemic.
And that's why today we have the honor of having an expert on the topic, a doctor who has been on the front lines against COVID-19 from the beginning.
That's right, Chris. We are here with Felix, who has dedicated tireless hours of work to understand, treat, and prevent the spread of his virus.
Before we dive into our conversation, we want to take a moment to reflect on how we get here. Let's remember that at the beginning of the pandemic, uncertainties and challenges were overwhelming.
Exactly, Jair. We have gone through a path full of learning and adaptations, both personally and collectively. From quarantines to the search for effective vaccines, every step has been a joint effort to society.
And in this process, we have seen the bravery and dedication of so many healthcare professionals who have worked tirelessly to keep us safe and healthy.
We ought adopt each of them has been a hero in this fight against COVID-19. And today we have the privilege of having one of them with us.
That's right. We are here to hear her experience, knowledge, and perspective on his pandemic that has impacted every corner of the world.
Okay, so let's begin with this important conversation. Feli, it's an honor to have you here with us today. So first, I want to tell you or ask you, for those who don't know you, what's your name?
Hello, everyone. Thank you for the time, and the honor is for me. My name is Felicita Romero Jimenez.
Okay, so thank you for being here. And if you want, I'm going to start with the first question, okay? As you already know, and as we already know, you are a doctor. So can you tell us about what's the COVID-19?
Estoy grabando.
Of course, Jair. Well, COVID-19, short of coronavirus disease 2019, is a highly contagious respiratory illness caused by the novel coronavirus SARS-CoV-2. And it was first identified in Wuhan, China in December 2019 and has since spread globally, resulting in a pandemic.
Yeah, the next question is, which are some symptoms of this disease?
Well, some common symptoms of COVID-19 include fever, dry cough, shortness of breath, fatigue, muscle or body aches, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. However, it's essential to note that symptoms can vary widely in severity and presentation. Sorry.
And can you explain the importance of widespread testing controlling the spread of COVID-19?
Yeah, widespread testing is pivotal in controlling the spread of COVID-19 as it enables early identification and isolation of affected individuals, thus preventing further transmissions by identifying both symptomatic and asymptomatic cases. Tastings help public health authorities implement targeted measures such as contact tracing and quarantine, ultimately reducing the spread of the virus within communities.
What role the vaccine combat COVID-19 pandemic?
The vaccines play a role in combating the pandemic by stimulating the immune system to produce antibodies against the virus. This helps prevent infection and reduces the severity of illness. Vaccine individuals vaccinated also contribute herd immunity, protecting vulnerable and reduce overall of the virus within communities.
So the next question is how has COVID-19
Jenny,
affected
your
different?
microphone is not turn it on.
Oh, sorry. The next question is how has COVID-19 affected different demographics, such as age groups, socioeconomic status, and geographic regions?
Yeah, COVID-19 has disproportionately affected different demographic with other adults, individuals with underlying health conditions, those in lower socioeconomic status or densely populated areas, facing higher risks of infections and severe outcomes. Additionally, disparities in access to healthcare, living conditions, and essential resources have exacerbated the impact of the pandemic or marginalized communities.
Have you gotten sick already of COVID-19?
No, fortunately, I haven't contracted COVID-19.
Do you know some case in what someone has this sick?
Although I haven't been infected, I've closely observed the experience of patients and witnessed the strain of the pandemic has placed on healthcare system worldwide. This experience underscores the critical importance of adhering to preventive measures and supporting effective public health interventions.
Do you have any familiar who had COVID?
Yes, I have family members who have contracted COVID-19.
How was it while they were sick?
While they were sick, they experienced various symptoms ranging from mild to severe. They had to undergo isolation and medical treatment to manage their symptoms and prevent the spread of the virus to others.
So we wonder how we can prevent the COVID-19. Do you have some recommendations?
Of course, well, preventing COVID-19 requires a multifaceted approach. Recommendations include practicing good hygiene and by frequently washing hands with soap and water, wearing masks in public settings, maintaining physical distance from others, avoiding crowded places, and getting vaccine when eligible. Additionally, staying informed about local public health guidelines and adhering to them diligently is crucial in preventing the spread of the virus.
What are the latest research findings on effective treatments for COVID-19?
Well, recent research has identified several promising treatments for COVID-19, including antiviral medication, monoclonal antibodies, and corticosteroids. These treatments have shown efficacy in reducing the severity of illness and improved outcomes for patients, particularly those who with severe and critical cases of COVID-19. However, treatment strategies may vary depending on individual patients' factors and the stage of the illness.
So how can patients recover more quickly from COVID-19 and avoid serious complications?
Patients can recover more quickly from COVID-19 and reduce the risk of serious complications by following the medical advice. Getting adequate rest, staying hydrated, and monitoring symptoms closely to any signs of deterioration. Additionally, early intervention with appropriate medical treatments, as recommended by healthcare professionals, and can help alleviate symptoms and prevent the progression of the illness to more severe stages.
Okay, those were all the questions, and I want to thank you. We seriously want to thank you for sharing your knowledge and experiences with us about COVID-19. I think you're so wise.
Also, it's
It was an honor.
been oh sorry, it's been truly enriching to hear your perspective and learn from your reflections on this topic that is so relevant to all of us.
Without a doubt, your dedication and commitment to the community's health are an example for all. We are truly grateful for your tireless work.
We hope this conversation has been equally meaningful for you, Doctor. Your voice is crucial in this ongoing fight.
So once again, thank you very much for joining us today and for giving us your valuable time.
Do you want to say something?
Thank you for your time, guys, and it was an honor for me.
No, thank you for you. And to our viewers, we want to thank you for tuning in and invite to you to keep taking care of yourself and staying informed about this challenging pandemic that has reminded us the importance of solidarity and the mutual core. Thank you.
Thank you.
Thank you.
Y ya, fue todo. Gracias, Feli.